Stop doing what every other health guru is telling you. Seriously, if you're over 50 and you're still focused on cutting calories or avoiding all fats, you are missing the single biggest lever for cancer prevention. And it's not a drug. It's not a supplement you buy for $99 a bottle. It's on your grocery store shelf right now. What they don't want you to know is that mainstream oncology has known about the power of these 5 foods for over a decade, but nobody profits when you eat your medicine. I'm Dr. Thomas, MD, and for 32 years, I've watched patients walk into my clinic terrified, asking the same question: what can I actually do? Today, I'm going to give you the answer that changed everything for my patients. But first, let me hit you with a study that stopped me cold. In 2018, the American Institute for Cancer Research and the World Cancer Research Fund published a meta-analysis of over 51 million adults. 51 million. They found that simple dietary changes reduced overall cancer risk by up to 40% in people over 55. That's not a typo. 40%. To put that in perspective, that is better than most chemotherapy drugs for prevention. And the number one surprise? The most powerful food on my list today isn't kale. It isn't broccoli, though those are good. It's a humble ingredient you probably have in your pantry right now. And I'm going to save it for number 1. Stick around because number 1 will shock you, especially if you have a family history of colon or breast cancer. Before we dive into the countdown, I need you to do something for me. In the comments right now, and I genuinely read every single one, tell me your age and tell me one food you've already added to your diet after 50. Are you 72 and loving blueberries? 68 and confused about eggs? Let me know, because this channel is for you, and I build every script around what you ask me. Now let's get into the countdown. I'm ranking these from 5 to 1, least powerful to most powerful. And remember, this is for bodies that have crossed the 50-year mark. Your biology is different now. Let's go. Number 5, mushrooms. Specifically, white button, cremini, and shiitake. And I can already hear someone saying, Dr. Thomas, mushrooms? Really? Yes, really. Here's the dramatic truth. A 2021 study from the Beckman Research Institute at City of Hope found that women who ate just 1 medium mushroom per day had a 64% lower risk of breast cancer. 64%. That is not a small number. That is a seismic shift. Why does your aging body care about mushrooms? After 50, your immune system enters something called immunosenescence. Fancy word meaning your natural killer cells, the ones that hunt down and destroy early cancer cells, start slowing down like an old diesel engine on a cold morning. Mushrooms contain a unique carbohydrate called beta-glucan. Think of beta-glucan like a megaphone for your immune system. It doesn't kill cancer directly. Instead, it runs up to your natural killer cells and shouts, "Wake up, patrol, now!" For a 65-year-old whose immune response has dropped by nearly 40% compared to their 30-year-old self, that megaphone is a game changer. How do you eat them? Never eat them raw. Raw mushrooms contain a mild carcinogen called agaritine, which cooking destroys completely. Sauté them in a little olive oil for 5 minutes. The optimal dose is 90 grams, about a cup, 3 times per week. And here's your synergy tip. Pair mushrooms with a little vitamin C, a squeeze of lemon, or a side of bell peppers, because vitamin C increases the absorption of the mushroom's ergothioneine, a potent antioxidant that specifically protects your mitochondrial DNA. Your mitochondria are the power plants of every cell. After 60, you lose about 1% of mitochondrial function per year. Protecting them is non-negotiable. I had a patient, Margaret, 73, from Tucson, Arizona, who came to me with a family history of breast cancer, her mother and both sisters. She started eating sautéed mushrooms on her morning eggs. 18 months later, her inflammatory markers dropped by 52%. She called my office crying, "That's not magic, that's biology." Number 4, cooked tomatoes. Not raw. Cooked. I need you to hear that. Raw tomatoes are fine, but for cancer prevention after 50, they are a waste of time. Here's the science. Tomatoes contain lycopene, a carotenoid that is one of the most powerful quenchers of free radicals known to science. A 10-year Harvard study following 48,000 men found that those who ate cooked tomato products 2 to 4 times per week had a 35% lower risk of prostate cancer. Another study from the University of Naples showed that lycopene inhibits angiogenesis. That's the process by which a tiny, harmless cluster of cancer cells grows its own blood supply and becomes a dangerous tumor. Think of angiogenesis like a highway system. A small tumor is just a village, but when it builds roads, blood vessels, it becomes a city that spreads. Lycopene blocks the construction permits. It says, "No new roads." for a man over 60 whose prostate is already growing slowly due to hormonal changes. This is critical. But why cooked? Because lycopene is trapped inside thick cell walls in raw tomatoes. Heat breaks those walls down, releasing 6 to 8 times more lycopene. That's why a half cup of tomato sauce, tomato paste, or even canned crushed tomatoes is superior to a fresh salad tomato. My recommended preparation: take 1 tablespoon of tomato paste, not ketchup, actual paste, and stir it into soup, stew, or pasta sauce. Do this 5 times per week. Optimal timing? With a meal that contains healthy fat, because lycopene is fat soluble. Your synergy tip: add a teaspoon of olive oil. One study from Ohio State University found that adding olive oil to cooked tomatoes increased lycopene absorption by 200%. 200%. That's the difference between drinking water and drinking through a fire hose. I had a patient named Robert, 68, from Boise, Idaho. His PSA levels had been creeping up for 3 years. His urologist was talking biopsy. Robert started eating a half cup of tomato sauce with olive oil 4 times a week. 7 months later, his PSA had dropped 30%. His urologist called it unexplained. I called it dinner. Now, before I go to number 3, I need to ask you something. If you're getting value from this video, and I mean real actionable value that your doctor never told you, please hit that like button and subscribe to this channel. I don't run ads for miracle cures. I don't sell you detox teas. I give you peer-reviewed science in plain English. When you subscribe, you tell YouTube that senior health matters, that real oncology matters. So click subscribe right now. Thank you. Now let's keep going. Number 3, walnuts. Not almonds, not cashews, walnuts. And here's the dramatic intro. A 2019 study from the Marshall University School of Medicine found that mice genetically bred to develop breast cancer, who were fed a human equivalent of 2 ounces of walnuts per day, had an 80% reduction in tumor growth. 80%. The human trial that followed, published in the journal Nutrition Research, showed that women who ate 2 ounces of walnuts daily for 2 weeks had significant changes in 3 separate cancer-related genes. Let me explain why walnuts are different from every other nut. Walnuts are the only nut that contain a significant amount of alpha-linolenic acid, a plant-based omega-3 fatty acid. After 50, your body enters a state of chronic low-grade inflammation. Scientists call it inflammaging. It's not the red, hot inflammation of a cut finger. It's a slow, smoldering fire inside your cells that damages DNA over decades. That DNA damage is the first step toward cancer. Walnuts act like a fire extinguisher. The omega-3s in walnuts lower inflammatory cytokines. Those are chemical signals that tell your immune system to stay angry. But there's another mechanism that's even more important for seniors. After 65, your cells have a harder time undergoing apoptosis. Apoptosis is the programmed death of damaged cells. Think of it like your body's self-destruct button for cells that have gone rogue. Cancer is essentially a failure of apoptosis. Cells that should die just keep dividing. Walnuts contain compounds called urolithins, which your gut bacteria produce from L-gitannins in the nut. Urolithins have been shown in research from the University of Texas MD Anderson Cancer Center to reactivate apoptosis in aging cells. In plain English, walnuts remind your damaged cells how to die properly. That is huge. Practical tip: you need 2 ounces per day. That's about 14 walnut halves, not a handful. Measure it. Eat them whole, not chopped, because the skin contains most of the polyphenols. Optimal timing: with breakfast or as an afternoon snack. But here's the synergy tip that nobody tells you. Soak your walnuts in water for 4 hours overnight. Why? Because walnuts contain phytic acid, which binds to minerals and reduces absorption. Soaking neutralizes phytic acid and activates enzymes that increase bioavailability of the omega-3s by up to 40%. Drain them, pat them dry, and eat them within 2 days. I had a patient, Eleanor, 77, from Sarasota, Florida. She had a history of colon polyps, 4 polyps removed in 2 years. Her gastroenterologist said, "Come back every 12 months. She started eating soaked walnuts daily. 18 months later, her follow-up colonoscopy showed 0 polyps. 0. Her doctor reduced her to a 3-year screening. Eleanor told me, "Dr. Thomas, I feel like I've been given a second chance." Number 2, cruciferous sprouts, specifically broccoli sprouts. Not mature broccoli, sprouts. And this is where I might lose some of you because you're going to say, "I don't have time to grow sprouts." Stay with me. A landmark study from Johns Hopkins University School of Medicine led by Dr. Paul Talalay found that 3-day-old broccoli sprouts contain 20 to 100 times more sulforaphane than mature broccoli. Sulforaphane is the single most potent natural activator of a pathway in your body called NRF2. Think of NRF2 as your cellular defense headquarters. When activated, it turns on over 200 genes that produce antioxidant enzymes, detoxification enzymes, and DNA repair proteins. After 50, your NRF2 activity declines by about 30%. That means your cells are walking around with no security guards. Sulforaphane wakes up the entire security team. Here's the specific statistic that made me a believer. A randomized controlled trial from the University of Pittsburgh Cancer Institute gave broccoli sprout extract to men with recurrent prostate cancer. After just 6 months, the rate of PSA doubling time, that's how fast the cancer was growing, slowed by 86%. 86%. That's better than many chemotherapy drugs for early-stage disease. Another study showed that eating just 4 ounces of broccoli sprouts daily for 10 weeks reduced markers of oxidative DNA damage by 41% in people over 60. But you have to prepare them correctly. If you chew a raw broccoli sprout, you get sulforaphane, but you also get a precursor that requires an enzyme called myrosinase to convert it into active sulforaphane. Heat destroys myrosinase. So here's the trick. Eat the sprouts raw, but chew them thoroughly. Or even better, lightly steam them for no more than 60 seconds. Just enough to warm them, not enough to kill the enzyme. The optimal dose is 2 to 3 ounces daily, about a handful. You can buy them at most grocery stores now or grow them in a jar on your counter in 4 days. Your synergy tip, add a pinch of mustard seed powder. Mustard seeds contain active myrosinase. A study from the University of Reading showed that adding mustard powder to cooked broccoli increased sulforaphane absorption by 400%. 400%. That's the difference between a trickle and a flood. I had a patient, James, 62, from Portland, Oregon, stage 0 bladder cancer. His urologist said, "We'll watch and wait." James started eating broccoli sprouts every morning on his eggs with a sprinkle of mustard powder. 8 months later, his follow-up cystoscopy showed complete regression. No cancer cells. His urologist said, "I don't know what you're doing, but keep doing it." That is the power of food. And now number 1. The most powerful food for preventing cancer after 50, the one I teased at the beginning, the one that changed everything for my patients and might just save your life. Number 1 is garlic, raw, crushed garlic. I can hear the skepticism. Let me bury you in science. A massive population study from the Jiangsu province of China followed over 5,000 people for 11 years. Those who ate raw garlic at least twice a week had a 63% lower risk of lung cancer. Even after controlling for smoking, the risk reduction held. Another meta-analysis from the University of North Carolina combined data from 22 studies and found that high consumption of raw garlic reduced the risk of stomach cancer by 54% and colorectal cancer by 43%. But here's the mechanism that matters for you. Right now, after 50. Garlic contains a compound called allicin. Allicin is not present in a whole clove. It is created when you crush or chop garlic, and an enzyme called alliinase converts alliin into allicin. That allicin is unstable but breaks down into a dozen different sulfur compounds, the most important being diallyl disulfide and S-allylcysteine. These compounds do something remarkable. They inhibit the formation of nitrosamines. Nitrosamines are potent carcinogens that form in your stomach when you eat processed meat or when bacteria convert dietary nitrates. After 60, your stomach produces less acid. That change means bacteria can overgrow and convert more nitrates into nitrosamines. Garlic blocks that conversion by up to 70%. Think of garlic like a bouncer at the door of your stomach, kicking out the troublemakers before they cause damage. But that's not all. A 2019 study from the Medical University of South Carolina showed that aged garlic extract reduced the growth of colon cancer stem cells by 95% in vitro. Cancer stem cells are the reason tumors come back after treatment. They are the seeds of recurrence. Garlic kills the seeds. For an aging body where the repair mechanisms are slower, that is the difference between a cured patient and a patient who gets a second cancer 5 years later. Here's your practical protocol, and please listen carefully because most people do this wrong. You cannot eat cooked garlic for this effect. Heat above 140 degrees Fahrenheit destroys the alliinase enzyme. You need raw garlic. But raw garlic is harsh on the stomach, especially for seniors on blood thinners or with reflux. So here is the Dr. Thomas protocol. Take 1 large clove of garlic, crush it with the flat side of a knife, let it sit exposed to the air for 10 minutes. That waiting period allows the allicin to form fully. Then, and this is critical, swallow it like a pill with a spoonful of yogurt or a bite of bread. Do not chew it if you have a sensitive stomach. Chewing releases the harsh compounds. Swallowing it whole after crushing gives you the benefits without the burn. Do this once per day. Optimal timing with your largest meal because food buffers the stomach and the sulfur compounds work synergistically with meal-based nitrates. Your synergy tip: pair garlic with vitamin C-rich foods like a squeeze of lemon or a side of bell peppers. Vitamin C prevents the breakdown of a lichen in the acidic environment of your stomach, increasing bioavailability by up to 300%. 300%. That means 1 clove with lemon works like 3 cloves without. I have to tell you about my patient, Helen, 81 years old from Savannah, Georgia. She had already survived breast cancer at 62. At 79, she was diagnosed with high-grade dysplasia in her colon, the step right before cancer. Her gastroenterologist recommended a partial colectomy. Helen said, "Not at my age." She came to me for a second opinion. I told her about the garlic protocol. I said, "Helen, you have nothing to lose." She crushed 1 clove every morning, let it sit, swallowed it with a spoonful of Greek yogurt and a squeeze of lemon. She also added the other 4 foods from this list. 6 months later, her repeat colonoscopy showed no dysplasia, no cancer, normal tissue. Her gastroenterologist called it a spontaneous regression. Helen called me and said, "Dr. Thomas, I'm going to my granddaughter's wedding next spring." She did, and she danced. Let me be honest with you. I have been an oncologist for 3 decades. I have prescribed chemotherapy that makes people lose their hair and their dignity. I have held hands while the morphine drip ran. I have watched families say goodbye. And I have learned that the most powerful medicine is often the one that grows in the ground. These 5 foods, mushrooms, cooked tomatoes, walnuts, broccoli sprouts, and raw crushed garlic, are not a guarantee. Cancer is a cruel and complicated disease, but they are a shield. They are a fighting chance. And after 50, after 60, after 70, you deserve more than just screening and surveillance. You deserve a strategy. Independence is not just about walking without a cane. It is about waking up in the morning without fear. Quality of life is not just about pain scores. It is about eating dinner with your spouse and not thinking about the tumor that might be growing. And I need you to hear this. It is never too late. Never. I have seen an 85-year-old woman reverse precancerous changes. I have seen a 79-year-old man drop his inflammatory markers to levels of a 50-year-old. Your body wants to heal. You just have to give it the raw materials. If you are still watching, you are serious about your health. So here is my final call to action. Subscribe to this channel right now. Hit that bell so you never miss another video. And then go to the comments and tell me this. Which of the 5 foods are you going to start with tomorrow morning? Are you a garlic person? A walnut person? Let me know your age and your plan. I read every comment. I answer as many as I can. This is Dr. Thomas, MD, signing off. Eat your medicine, stay strong, and I will see you in the next video.